ABC News medical contributor, Dr. Darien Sutton. Dr. Sutton, let's talk about, we've heard about the tsunami of cases. While many of the Omicron cases appear to be mild, I'm curious what you're actually seeing in the ER and what's the real concern for people here.
Well, good morning, Eva. You know, the real issue right now is volume, as the amount of patients that are coming in associated with the COVID-19 and its Omicron variant are simply depleting hospital resources, staff, and bringing the hospital to a capacity that is not sustainable. In the emergency rooms here, we're seeing long wait times. We're erecting tents outside of the emergency room to help triage patients. And it's also important to understand that the patients that are admitted from the emergency room don't yet have room to go upstairs simply because the hospital is full, which further slows the transit down. And then this, of course, affects outpatient care. Procedures like colonoscopies, mammograms, as well as chemotherapy and dialysis all get postponed and delayed, so all patients are negatively affected by this.
Let's also talk about flu-rona, this being infected by both the flu and COVID-19 at the same time. It was first found in California. I'm curious if you've seen this yet in the ER where you work, and what's the treatment like for this combination?
Yeah, well, flu-rona is a term that I think an unfortunate term. I don't like it because I really like to just identify what the actual issue is, which is that we have a flu season superimposed onto an ongoing surging pandemic, and unfortunately, people who are getting infected by both. It is rare, but it is something that we're seeing across the country simply because of the rates of COVID-19, again, superimposed on top of this flu season. Fortunately, we have not seen many patients, and I have not seen many myself, but I will say that I have seen concomitant infections of the flu and other viral infections that patients get. It is something that we see, and it's unfortunate, but it's something that we can still control. The main thing to remember, though, is that you can get vaccinations for both of these, and you can get them at the same time.
And important to remember that they are two separate things there. The CDC has this new study out that's found an increased risk of diabetes for children who've been infected with COVID-19. Really concerning for parents and children out there. What do these findings tell you about the risk to children?
Well, this is certainly a concerning report by the European Union in review of pediatric populations, and they found that those under the age of 18 who had gotten COVID-19 were more likely to get a diagnosis of diabetes. Now, the reason behind this is not completely understood, but the SARS-CoV-2 virus does attack other organs, including the lungs, including the pancreas as well, as the ACE2 receptors that the virus binds to can be found on the pancreas. And it's also not the first time we've seen a viral infection associated with some type of chronic disease. We've seen Epstein-Barr virus that commonly causes mononucleosis associated with other lymphoproliferative disorders in certain patient groups. And we've even seen the varicella virus that causes chickenpox in childhood, lay dormant and stay within the body to later cause shingles. So it's important to remember that these are the reasons why we get vaccinated, not just from the individual acute infection, but also the complications.
And so much we are still learning about this virus, so much time into it here. Dr. Sutton, thanks so much for being with us.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.